everybody's our #1 goal. You can't cover up each and every hole. We're always plotting some brand new schemes. We're scaring parents about kids' vaccines. The measles virus is on the rise, 'cause parents don't get their kids immunized. In this age, we travel in style, and we earn many a frequent flyer mile. Yesterday, far away, one of us grows a jet flight today, and we're in your nose. Against us bugs, no security. So don your mask and call CDC. Wear gloves, wear condoms, use DDT. You might gram stain us, but you can't contain us or our family. Hey! You know, Greg, we should get together sometime and talk about your entire investment portfolio.
Investment portfolio? Investment portfolio? I can't even pay my Visa bills.
Seriously, Greg, at your age and in these uncertain times, you need a balanced portfolio. Birthing clinics, screening centers, funeral parlors.
Oh, I get it. Check in, check up, check out. Okay, fine. Let's do lunch sometime.
You got your paper calendar there on your tie?
I have a calendar, yes.
It was a paper calendar. I got my new smartwatch here. It's a combination timepiece, web browser, and mobile diagnostic tool.
Mobile diagnostic tool?
Yes. Would you like me to do your virtual colonoscopy?
Virtual colonoscopy?
Uh-oh.
What?
Uh-oh.
What?
And just three little polyps.
Polyps?
Not to worry. I'm going to zap them with the nano laser.
Huh? Ow! Hey! Jeez, stop! What is that thing used for batteries?
Well, it's made in Iran, so it's nuclear powered. How about lunch this coming Tuesday? Tuesday, the 28th of October. How about that?
28th of October? Oh, no time. I've got a downsizing committee meeting then.
Oh, too bad.
Oh, how about Wednesday, November the 5th?
No time. My hospital's having a Chapter 11 bankruptcy hearing that day. No. How about Thursday, December the 18th, the week before Christmas? How about
December the 18th. Nope, no time. I am starting my mini residency in cosmetic surgery that weekend. Ooh, I have it. How about after the New Year?
Sure.
Friday, January 9th.
No time. I'm starting my Amway distributorship then.
Oh.
Listen, why don't I send you a tweet or something with my available dates for the next few years?
Right. Who has time for anything anymore?
I've got lots of piles of stuff to put in files.
I'm too busy with patients' needs. I can't read.
No time.
Time just to be employed. No time to be enjoyed.
What do I hear from the kids and wife? Get a life. Get a life. No time. No time. Life's supposed to be lots of giving, but my life's just earning a living. No time. A chocolate bar and fries. No lunch, no exercise.
There's no time left to heal myself. No time left to reveal myself.
No time, no time. Someday when we are retired, maybe then we'll be inspired to take time.
Time, please wait for us.
Time, please be late for us. Lots more things that we want to be with our friends and family. No time, no time, no time. Greg, I just got some venture capital. I'm starting a new business. You visit me in my booth in the exhibition hall. It's called Modular Medicine. Modular Medicine. Modular Medicine. Check it out later, would you please?
What the
Modular Medicine.
What the heck is modular medicine?
Modular Medicine. How can I explain it to somebody like you, Greg? What do you do when your desktop computer breaks down? I mean, do you call a repairman?
Well, no, that's much too expensive these
Right,
days. I think
right.
you take out the old part, throw it away,
Throw it away.
go on the internet, you
Go on
order
the
a new
internet,
part from
new part.
somebody, it shows up in the mail, you plug it in, and you're up and flying again.
Same concept with human beings.
Well, you're talking about transplants.
Yep, that's exactly what I'm talking about.
Well, that's always been a lovely concept, but what are you going to do about the donor problem?
Well, what I'm doing about the donor problem is I'm cloning pigs in my garage.
Cloning pigs in your garage?
And I'm selling the organs on eBay.
Selling the organs on eBay? Barry, have you considered the ethical implications of that?
Greg, have you considered the investment opportunities?
Investment opportunities. Oh my God, I can just see this. 200-year-old baby boomers wandering around huge shopping malls searching for spare parts. Got myself a kidney and adrenal gland.
Next week I am getting someone else's hand.
Got a brand new ticker.
Now my hair is thicker.
Got myself new legs, but don't know where I stand.
A new man's in my shoes.
Got the spare parts blues. Got myself new eardrums, everything sounds strange.
Got myself new gonads, but my sex didn't change.
Got a llama's liver.
Makes you wanna shiver.
Got a new persona.
1-for-1 exchange, brand new skin.
Don't know who's. Got the spare parts blues. Spare parts, spare parts. It's getting so no doctor can repair parts. Spare parts, rare parts.
It's getting so with animals we share parts.
Got myself new muscles that I can't maintain.
Got myself new nerves in someone else's pain.
Now and then I sicken, cause my stomach's chicken.
Got eyes of an eagle, but a turkey's brain.
Who am I? Got no
clues.
Got the spare parts, spare parts, spare parts blues. Yeah. So Barry, there is something I do not understand here. I don't understand how you could be talking about everything getting bigger and bigger when, in my experience, everything seems to be getting smaller and smaller.
Well, Greg, that's called downsizing. Downsizing.
Oh, downsizing. I get it.
It's a low-tech slide.
Fewer doctors.
Fewer doctors, that's correct, but looked at in a slightly different way, a lot more efficiency from each of the few remaining doctors.
Right. Fewer clinics.
Fewer clinics, true, but a lot more productivity from each of the fewer remaining clinics.
Right, and of course all of this leads to lower costs.
Lower costs, correct, but higher stock prices.
Oh, higher stock prices. I should have guessed.
Now you're beginning to understand cost containment. We have cut every needless expense, all that cures, everything that prevents, we have cut, even good common sense. That's cost containment. Tell patients that they've overstayed. Tell the docs that they cannot be paid. Fire 3 nurses, hire an aide. That's cost containment. The day of decision will soon arrive. Yes, we're concerned that our patients survive. But first, our hospital must stay alive by replacing health maintenance with good cost containment. Close the lab, close the visitors drawn. Don't go mad, cause the shrinks have moved on. Have a Coke, the cafeteria's gone. That's cost containment. Medicare's not been cut, its rate of rise has decreased.
Medicaid's not been cut, it is only deceased.
Who needs a doctor? Go out, get a priest. It's economizing and everyone's downsizing. You may think that you need a nurse. There are no nurses left, get a hearse. You may think that the system's perverse. We're all feeling worse.
Healthcare's in reverse,
but we're reimbursed. That's cost containment. Greg, you know, the logical extension of all this cost containment is the end of the medical profession.
Oh, you mean no more doctors?
I mean, no more doctors. What do you think I meant?
Well, it's certainly possible with the way things are going.
We need doctors with the efficiencies of managed care.
Yeah, computers replacing everything that we do.
Yeah.
And you know, even scarier yet, dogs may be replacing doctors for the remaining things we are needed to do.
Dogs?
Yeah.
Did you say dogs?
Yeah, Barry, check out the entry in this class notes section of our medical school's alumni magazine.
When do you have time to read that silly stuff?
No, Barry, listen to this. Oh, here. Bob Martin, senior member of an oncology group in Hartford, has 5 kids, 2 grandchildren, wife, and a dog who makes rounds with him at the hospital. Yeah. A press piece from the hospital says that her name is Abby, and her visits have been extremely well received by patients and staff due to her extraordinary innate sense of how to react to people, especially children who are not feeling well. The hospital is considering a hospital-wide program of pet therapy.
Pet therapy?
Right. No need for doctors anymore.
Huh.
Are we a pair? Best team around. Me very high in the air, you on the ground. Send in the dogs. Smell wine on breath. Hear high-pitched heart sounds. Able to sniff out the cause of every disease on patient rounds. Just send in the dogs. Make sure there are no fleas. And now I wait. Open your door. Await the sound of your bark, the step of your paw, making your entrance seem much more important than mine. I've not complained. You've got me trained. You're just a dog. You're just my pet. I, in my dreams, never thought you'd be a threat. I feel my heart throb. You small furry slob. You've taken my job. Ruff, ruff, ruff. So Barry, there's something I still don't understand here. I don't understand how your hospital is doing so well when our hospital is going in the toilet.
Time to listen to my lecture series.
Lecture series. You have a lecture series.
Of course I have a lecture series. It's called PowerPoints to Profit, Transforming Your Patient Mix.
Transforming your patient mix?
Yes, it's now out on CD, interactive DVD, downloadable MP3, and of course Blu-ray. It's gone viral. Here, have a listen.
Barry, I can't even open the shrink wrap on these things.
You're
Could you summarize this for me, please?
Sure, I'll summarize it just for you. Lecture number 1, only sell to the worried well.
Only sell to the worried well?
Lecture number 2, importantly, how to avoid the unemployed.
Avoid the unemployed?
And most importantly, lecture number 3, do not pick the sick.
Do not pick the sick. Barry, what about the community hospital's responsibility to the community?
Greg, there's money to be made. Smart hospitals succeed by not admitting people who are poor who may bleed. You only need to say these 4 words quick. Go away, you're sick.
Oh, look, here comes an ambulance. Admit him, he's in shock.
I think he smells like beer.
Admit him.
Better not, the city hospital is near.
I think he has a hemorrhage, treat him quick.
Go away, you're sick.
Hey!
Greg, it's clear that things will worsen unless we're in the black. We don't treat an ailing person till we get our money back.
Oh, look, this one's for psych. She hears voices in her head.
I think she is a fake.
I think she's schizophrenic.
No, I think that's a mistake.
Admit her to the ward, her wrists have cuts.
Go away, you're nuts.
Huh?
Greg, the way you think's outmoded. Treat the well, not those near dead. All your bills should be recoded.
or we'll end up in the red.
Well said.
So a surplus can be made.
Patients buy what we can sell.
So if you are on
We
welfare,
don't care if we say farewell.
all hospitals must learn this little trick.
Do not pick the sick. That's right. To this mantra we must always stick. Go away. You're sick.
You're sick.
You're sick.
You're sick.
Now go away. You're sick.
Ladies and gentlemen, we take you now to a meeting of the ultimate gatekeepers.
This is terrible. This is unspeakable.
Oh, what's so terrible? What's so unspeakable?
Oh, it's Obamacare.
What about Obamacare?
Well, people are actually starting to like Obamacare.
People are starting to like Obamacare? What are we going to do?
What are we going to do? What are we going to do? Oh, shut up. I must think. A plan. Yeah. Ooh. Wait a minute. I have got it.
What do you got?
Well, you see, if people are starting to like Obamacare, then we must simply give them more of what they like. This policy appears to cover everyone and everything.
But on closer inspection, it covers nobody and nothing.
Precisely. The devil's in the details.
Look at this policy. It's great. We do not cover oral health or anything that's dental.
We do not cover psychic health or anything that's mental.
We do not cover eyeballs even if you're going blind, cause everything that's in your head's just in your mind. We will fight, protect patients' rights. We're only here to please. Just don't get sick. You'll find out real quick. We don't cover your disease.
Check out Rider Q.
We talk about prevention, but don't put it into practice.
The long-term savings from your better health will not impact us.
We're here to make a short-term killing. You might call it greed. You signed up for a policy you didn't read. We will fight, protect patients' rights. We're only here to please. Just don't get sick. You'll find out real quick. We don't cover your disease.
Ooh,
Tambourines.
Tambourines.
We do not cover pre-existing diagnosed conditions. We do not cover chief complaints that might come to fruition. We do not cover chief complaints, no matter big or small. We do not cover anything, no, not at all. We will fight, protect patients' rights. We're only here to please. Just don't get sick. You'll find out real quick. We don't cover your disease. Hey! Greg, look at this. A healthcare policy that covers nobody and nothing. What a remarkable way to make money.
Money again?
Save this one. I'm going to put
Barry,
this one away.
I just do not understand what happened to you. When we were in medical school, we used to go to third world countries and work in health clinics together. Now you're wearing an Armani suit and smoking a Cuban cigar.
Greg, I don't know what happened to you. In medical school, you were the positive one. You were the idealist. And now you are negative. Negative. Isn't he negative? Negative.
I'm not negative. I'm just trying to figure out how somebody like you, who is so committed to public health, ends up as this money-grubbing entrepreneur.
Look, when the politicians started taking over public health, I just got fed up. I said, screw this. I'm going into business for myself. Now when I make money, everybody wins.
Huh.
And you, Greg, what happened to you?
Well, you know, after practicing medicine for almost 40 years, I just burned out. I mean, I was fighting with the insurance companies. I was fighting with the hospitals. I was fighting with my colleagues. I was fighting with the patients. I was fighting with my wife, my kids. I was fighting with everybody. I'm on strike. I'm in debt. I mean, I'm running as fast as I can to stay where I am, and I'm falling behind. I'm going under here. I don't know why I went into medicine in the first place. Hey, why did we go into medicine in the first place?
I don't know about you, but when my Uncle Lou, who was a family practitioner, delivered me, he turned to my mother and said, "It's a doctor." So from day one, it was all predetermined. Seriously, though, as I grew up, even though I grew up with that story, I got to see that being a doctor was not such a bad thing after all. Steady income, intellectual stimulation, and you could not only cure people, but you could prevent them from getting sick in the first place. And you, Greg, why did you become a doctor?
You know, I haven't thought about that in a very long time. But the other day, I had this memory. When I was a little kid, about 7 years old, out of the blue one night, I had this asthma attack. I mean, it scared the living daylights out of me. My parents stuck me in the bathroom, and they're running hot water in the bathtub, and the steam is bubbling up, and it's filling the room, and I'm sitting on the toilet, and I'm screaming, "I can't breathe, please help me, I don't want to die." My parents called our family doctor.
Right.
This guy made a house call, and he came and he gave me the shot of adrenaline. But then he sat there and he held my hand and he kept telling me these stories until my breathing started getting easier and I started feeling better. And as I was growing up and going through school, I kept thinking about this guy. And I kept thinking, you know, it wasn't so much that shot of adrenaline as it was him telling me those stories and holding my hand.
Well, the human touch is so important. I chose to be a doctor of medicine, to live a life in which I could excel, to serve the public with preventive medicine, to help keep people well.
I chose to be a doctor of medicine, to live a life with a loftier ideal, to serve my patients, practicing good medicine, to treat, to teach, to heal.
Then you got burnt out, work became just a grind.
You started a business, got lost.
You couldn't keep up, progress left you behind.
You became rich, but you didn't see the cost.
Still we can feel the magic of medicine.
A mystery like forces from above.
Still we can hear the music of medicine, a symphony of love.
How can I contact the Greg I once knew?
Can I look myself in the eye?
Can I find the meaning in all that I do?
Is my life just a lie? Who are you? Who am I? We'll always be two doctors of medicine, no matter what, no matter where or when. We've sworn an oath, we pledge our lives to medicine. Two doctors of medicine in harmony again. Well, Greg, we sure covered a lot of problems this morning.
Well, change brings with it problems, but also opportunities. Hey, didn't you say that a little while ago?
I did say that.
Well, somebody's got to be responsible for this mess that we're all in.
Who do you suppose that could be?
You and me.
Me and you.
Yeah, us and them.
Them and us.
Yeah, all of us together, or at least partially responsible for the mess that we're all in.
All of us together.
Yeah, and if we all help to create these problems, maybe we all can help do something to solve them.
Maybe we all can do something to solve them. If we want to shape the change, let's go and see what people need and listen to our inner voice, and then as leaders take the lead.
When there's love that fills our heart, when there is spirit in our soul, then together we can heal the world, make it whole.
Change is not a passing fashion.
Must be nurtured, must be planned.
Must be carried out with passion.
Needs our heart and needs our hand. For good patient care and a system that's fair, take a stand.
If we want to shape the change, let's go and see what people need and listen to our inner voice, and then as leaders take the lead.
When there's love that fills our heart, when there is spirit in our soul, then together we can heal the world, make it whole.
With each word that speaks our mission,
with each action that we take,
we'll embrace change with our vision.
See the difference that we make.
The health of the nation, the next generation's at stake. If we want to shape the change, let's go and see what people need and listen to our inner voice. And then as leaders take the lead, when there's love that fills our heart, when there's spirit in our soul, then together we can heal the world, make it whole. Our heart and soul.
Damage Care, Dr. Barry Levy and Dr. Greg Lagana.
Brad Ross on the keyboard. Damage Care, we left issues on your plate. Damage Care, do your part, it's not too late. Now our musical is over, there's a lot of work to do for our healthcare to improve. It all depends on me and you. If we work together, then we can repair. Damage Care.
Thank you.
Brad Ross on the
Brad
piano.
Ross.